I chose a career in medicine because I found it was the best way to combine my interest in the sciences and my interest in advocating for women and for patients. So I had always been interested in biology and chemistry, and through a bunch of different experiences trying out laboratory research, clinical research, and shadowing in the clinic, I found that I really liked the patient care aspect of things and really liked bringing kind of the advances in scientific research directly to patients. And I've also always had an interest in women's health and women's rights in general. And I found that being in that medicine career clinical spot was the ideal point for me where I could use my training in the sciences and in healthcare to be a voice for patients and for women in the medical field as an advocate. And so it allowed me to really combine all my interests and passions together and try to use that to make a positive change on the world. And I am so glad that I chose this career and wouldn't have it any other way. So when I was a medical student, thinking about what specialty I would choose or what career path I would have, I let a lot of talk and experiences from people who didn't share my values shape the choices that I made. So for example, people saying, if you go into surgery, you'll never be able to have a family. And I let that guide the choices that I made because I was trying to take that advice into consideration, but never stop to think, hey, I'm going to make my own path and forge my own choices. So essentially, don't let the naysayers get to you. Choose your own path, and you can walk that path in a way that works for you. It may not be traditional, it may take longer, it may be a little different in how it looks, but you absolutely have the freedom and the flexibility to make the choices that are going to give you satisfaction and success in the long term.